We recognize that this is an overwhelming time for you. You have a lot of things to learn about diet and medications, and we don't want you to forget that you are a whole person. It's your mind, your spirit. Don't forget that you need to be living your life with joy. And these things are going to be as important for your health as any of the measures we've talked about. Watching your diet, taking your medications, going to see your provider on a regular basis, and forming a relationship with that provider so that you can talk about if you feel sad or if you feel anxious or nervous. These things can be worked out, and you can talk about the things that are happening in your life with your relationships with your family. You may have times where everything feels very overwhelming, feelings of depression, anxiety. There are many breathing techniques to try and lower your stress level. Walking, breathing, meditation is another thing you can find out about to help reduce your stress and your emotional health. It's normal to feel depressed or anxious during this time because everything is very overwhelming. You have all these new medications you have to take, you have physician appointments you have to go to, which are going to interfere with your lifestyle, your plans. But remember that you are a spiritual being and that your emotional health is just as important as your physical health. Please remember the things that bring you joy in your life. Don't stop doing things that you did, such as gardening or dancing or whatever activities it was, playing golf. You can do all these things. They contribute to your emotional well-being. We will give you a resource list of places that you can go, contacts that you can make to help with all these things. Diet, emotional health, maybe talking to a psychologist, that might be helpful. If you're feeling overwhelmed by the financial burden of medications, you can turn to the pharmacist and your provider, who can point you in the direction of resources that are there to assist with any financial problems. They often have resources for getting medications at lower prices and would know about those places to refer you. Well, in closing, I'd like to say that we always want patients to feel like they are Ohana, and that we care about what happens to you when you leave the hospital. And so that if there are any questions, never be afraid to ask. There is no dumb question, and we're all here to help you manage your life and have. We want you all to be healthy and be happy and enjoy your time with your family and your friends. Aloha.
Aloha.